Okay, we're ready.
Welcome back to the afternoon session of our policies with Clackamas County Board of Commissioners on this September 14th. Gary, you're up.
Thank you, Chair Smith. All commissioners are present and Commissioner Fisher is online. Your first policy session is overview of Clackamas County's Emergency Medical Services Program. We have staff from Health, Housing, Human Services, Philip Mason Joyner and Bill Conway to present. Please go ahead.
Thank you, Gary. Good morning, Chair. Or I always say good morning because I'm usually here in the morning. Good afternoon, Chair Smith and Commissioners. Yes, Philip Mason Joyner, your Public Health Director, joined, and I'd like to officially introduce the board to Bill Conway, who is our EMS coordinator here at Clackamas County. He's been here a little over a year after 27 years of service at Clackamas Fire as our EMS Division Chief. So really thankful to have Bill's expertise leading this work and moving emergency medical services forward here at Clackamas County, helping with wildfire and pandemic response too, as a side gig as well. We do have a PowerPoint slideshow. Shannon, if you could please put that up, and Bill will get us started with the presentation.
Thank you, Philip. And good afternoon, Chair Smith and Board of County Commissioners. We'll give you a brief overview of the Emergency Medical Services, or EMS system, in Clackamas County. Appreciate the opportunity to present to you today. I want to start by saying that EMS isn't simply transporting patients to the hospital. EMS is providing quality, advanced medical care to the community. And for some, EMS is the only access to health care. This is accessing things like medical care or mental health care, addiction services, and even dental care. Next slide, please. So in Oregon, state law requires that counties establish and ensure EMS transport coverage to the residents. And this is done through an ambulance service area plan. In Clackamas County, this is done through the local public health authority. And in Clackamas County, the ambulance service area plan identified 3 ambulance service areas. So our 3 ambulance service areas are the Clackamas Ambulance Service Area, which is the largest, and it is served by American Medical Response Northwest. The Canby Ambulance Service Area is served by Canby Fire District, and the Molalla Ambulance Service Area is provided by and served by Molalla Fire District. Next slide, please. So here is a map of the 3 ambulance service areas. You'll see Clackamas is the largest. You'll see the Molalla and the Canby ASA. And the little sliver, kind of the middle far left, is not an actual ambulance service area, but it is an area due to geography provided by Woodburn Ambulance, which is now Metro West Ambulance. Next slide, please. So Clackamas County established their first ambulance service area plan in 1991. The current plan is from 2012. And county staff and the EMS Council are in the process of reviewing and updating the Clackamas County Ambulance Service Plan. The purpose of the plan is to ensure that we provide the highest quality patient care and a timely response to medical emergencies. And this plan, it establishes the requirements, as you can see, for EMS and 911, but it also sets educational training and quality improvement standards, as well as penalties for non-compliance to providing that care. Next slide, please. So in Clackamas County, our EMS response model is what we call a dual advanced life support model. And what that means is it means the contracted or provider who's providing the ambulance service and the fire first responders all respond to medical calls. So they're both dispatched to medical calls at the same time. What this does is it provides a very broad out-of-hospital medical care coverage as well as firefighting coverage. And what we do in our county is the treatment and the transport to our community is provided through a collaborative and combined effort in the Clackamas ASA, AMR, and fire assets. But the other thing that this dual advanced life support response model does for us, it provides enough crew members to not only respond to and mitigate minor medical emergencies, but also more complex emergencies that require a lot more people, such as cardiac arrest. Next slide, please.
The funding for this program is primarily based on individuals who utilize these services, folks who call 911 and then need to be transported to an area hospital. Currently, the plan and the contract dictate the costs, the fees to patients. It's close to $1,400 per transport. Of course, individuals paying out of pockets, it's really dependent on their insurance type that they have. Some pay $50 copays, some pay a couple $100, and if you're uninsured, it would be the full amount. AMR, this is a franchise fee. So AMR Northwest, in order to have exclusive opportunity to provide these transports to the hospital, they pay the county close to $131,000 every quarter, which helps support the costs for the program, primarily county staff time. And also we have emergency medical, a small team of emergency medical directors that all the paramedics in the county operate under license. They follow their protocols, and they assure that the clinical standards are in place to make sure that patient care is of quality. And then something unique in terms of how this program is funded that a lot of counties across Oregon have reach out to us all the time and learn about is our cost savings account. AMR provides $386,000 annually to the county. 60% of that goes to 3 of the participating fire agencies that Bill mentioned: Clackamas Fire District Number 1, Lake Oswego Fire, and Tualatin Valley Fire and Rescue. So that in terms of being a team where they're collaborating and working together on this and sharing the transport to the hospitals, collaborative work between AMR and those fire agencies, and they get paid and compensated to do that. And then 20% of the funding is for compassion care, so for individuals who aren't financially able to pay that patient fee, there's a fund set aside to help cover those costs if they have a financial burden. And then system enhancement, and that's really the work of our EMS Council, where they have a strategic plan and are really working on training, equipment, new technology, that those funds, they work together through the EMS Council to determine how those funds will be spent in order to try to standardize tools and equipment and technology, as I said. So that's in general how the funding happens within this program. Next slide, please, Shannon.
So the current 2012 Ambulance Service Area Plan in Clackamas County sets response zones, and then for each response zone, there is a minimum response time associated with each zone. So the urban zone, the requirement is 8 minutes, suburban 12, rural 25, and frontier 120. And the requirement is that the agencies meet these times. 90% or greater of the calls meet that response time. Next slide, please.
Excuse me,
Yes, ma'am.
Frontier Zone, 2 hours?
Yes, ma'am.
Where's that?
That's like way out. You could, if you turn around, you see like Mount Hood National Forest way out in what we call frontier. Hard to access, very, very low population, mostly unpopulated for the most part. Did that answer your question, Chair?
Yes, it did. Thank you, Clint.
You're very welcome. Next slide, please. So the current ambulance service contract was adopted in May of 2024, and this is for the Clackamas ASA, and this, as it says, provides exclusive service to American Medical Response in the Clackamas ASA through a franchise agreement with the county. This contract expires in May of 2024, and I believe in December, the BCC approved a good faith agreement with AMR that we're going to develop a performance-based contract. And the agreement says that we will negotiate through December 31st in good faith. We will negotiate in good faith through December 31st, 2021. Next slide, please. So the Clackamas County EMS Council is your advisory board to you. It's your subject matter experts that include medical directors, it includes responders, it includes a member of the general public, it includes representatives from our 911 system. There are a lot of subject matter experts on this council. They oversee the strategic plan that the Board of County Commissioners assigned to them. And it also establishes subcommittees or groups to provide, I guess, to do work, if you will. We have 4 Work groups or subcommittees. One is the Quality Improvement Committee. One is the Multi-Agency Training Group, which coordinates training for all of the agencies in Clackamas County. There's the System Enhancement Committee, which Philip mentioned, and there's the Operations Subcommittee. There's a fifth committee currently, which is the Strategic Plan Task Force, which has been tasked with implementing the EMS strategic plan. Next slide, please. And just as a reminder, the EMS strategic plan has 11 points, 11 areas of improvement. We won't go over all of them, but a few of the critical ones that we're making progress right now are the ambulance service area plan review, community paramedic program, and mobile integrated health. And we're working on things such as Project Hope, which I'm sure you've heard about with the opioid abuse reduction program. It's helped a lot with vaccinations, a lot of other really good work coming from the community paramedic program. And then the compliance, transparency, and improvement, we've made a lot of progress with related to our First Watch software system that will allow us to utilize that tool to improve transparency and the work it takes to ensure compliance to the contract. Next slide, please.
So that's all the information we have. It's a complex topic. There's a lot that could be dived into, but we want to provide a very high-level overview to not overwhelm, and plenty of time for any questions. Our hope and our request today is to come back later this fall for another policy session to discuss the performance-based contract with AMR. The strategic plan task force that Bill mentioned has been working on the scope of work for that, really working through all the details on what that performance-based, the new contract with AMR could look like for your consideration. I'd just like to open up for any questions that the board may have.
Any questions? Ross?
Yes, your letter here today says that the cost is approximately $6 million annually. What percentage of that goes to AMR?
That's a great question, and I'll write that question down and come and get that information to you.
Okay, let me rephrase the question then. Of the $6 million, does part of that goes to Malala Fire, Canby Fire, and part goes to AMR? Is that right?
No, sir. The $6 million is specifically related to the Clackamas ASA.
Okay.
That specific ASA.
Okay.
So I just want to get a better idea of the progress we're making. I remember over a year ago, or about a year ago, I think, when this came up, I remember that there was progress when I asked back then. There was progress being made at the EMS Council on that, and it had stopped, whether it was May or June, and not much progress was made. Granted, COVID was part of that. And it was like a period where just nothing really happened. So now here we are, and similar time of the year, roughly. And the question is, if our work is supposed to be completed by the year's end, how are we doing? What's the measuring stick? Are we got a working draft? How far along are we?
We've done a lot of work on the scope of work, made a lot of progress, and hope to have that buttoned up really soon so you actually have something to see. Here's the plan, here's what we've done, here's what we've left to do. But I think that document that you're referring to that showed that there was a lot of time that went by that nothing was done, we did a really poor job in articulating what actually has been done, because a lot of work happened during that period of time. It just was not in that spreadsheet. So we've done things like we evaluated and chose and implemented a patient care software program that all of the fire agencies are using, which is unheard of. We've implemented First Watch, what we would call that?
Real-time data surveillance system for EMS, which has never been in place in the county.
Yep. Implemented that. We went to all of the EMS agencies, fire and AMR, all went to the same EMS kits. which is trauma kit, medical kit. I mean, that may seem like a small thing to you guys, but it is monumental for every rig to have the same equipment. So that if you have an ambulance there and a fire unit there, or two different fire agencies, they all have the same equipment, so there's no delay in patient care. There's no, trying to find equipment. So there's been a lot of things we accomplished during that time. We just did a really poor job informing you.
Okay.
I would say in terms of the scope of work, the framework is there. We've been meeting regularly with AMR in good faith around these negotiations, having consistent conversation. There's great alignment and collaboration across the agencies. And really it's around the details because, the past contract, it's been performance-based, I would say, in a sense that it's really focused just on those response times. And now this adds the clinical standards that personnel need to have. It adds looking at the patient health outcome, essentially. What happened to the patient and how are we actually performing in terms of the clinical services that were provided. And that's really the future of this work that a lot of communities across the country are looking at. There's not a whole lot of examples that are readily out there. It takes these investments of these new technologies that we've been able to put in place the last year for it to happen. So I think there's that solid progress in place that's happened. The scope of work will be at a really good point to be ready for your review and input and a determination on if you'd like to move forward with this approach or not. And then it's just a matter of working with our county council to turn that scope into the contract with all the legal pieces that are necessary.
Okay, and again, I'm not any kind of experience or anything to be an authority on this. I'm not. I want to just put that out there. So the scope of work sounds like the beginning. So typically, when we do a scope of work, we're starting a program, right? And then we're supposed to be, I think, as by the displayed up on the PowerPoint there, near completion by the end of the year. So what is it that it's a scope of work that'll be ready? And then you said legal counsels. Can you just give me just a thumbnail sketch of the procedure? So come fall, late this year, we'll have something to look at, which will be the scope of work, right?
Yes, sir.
Okay, and the scope of work goes to the legal counsel to draw up a contract?
You'll have a scope of work, and our hope was that at that point to determine the board's determines direction. Do you want to continue on this path to move forward on a new contract with AMR? Really, that decision needs to happen in early 2022 because our existing contract ends May 2024. If we decide not to go this direction and this performance-based contract with AMR, then we're looking at a competitive RFP process because it takes about 18 months in order to go through an RFP process. So our hope is that this fall, the board will set a direction on if you want to move forward with this approach or not. And if you do want to move forward with the scope of work, I imagine it wouldn't take a significant amount of time, a couple months. I don't want to speak for county council, they're not in the room, but if you want to move forward with the performance-based contract as a board, then it would give us plenty of time to put that contract into place.
Okay.
It just has to be done before May 2024. It could go into effect earlier if the county and AMR both come to agreement to do that.
Okay. Yeah, and my last comment is this, or question is maybe it's more of a comment, and that is I'd certainly like to understand, because we're talking about a performance contract, which sounds like it's a little bit different than we currently have. And I know that innovation's been something that everyone's wanted to have incorporated in there, the ability to advance and everything. So I'd certainly like at the time, come December, whenever we see this, to be able to understand the difference or to be able to side by side say, here's what we currently have, what the contract looks like, here's the elements, and here's what the performance one looks like to make sure or to help ensure what's unique about this and how innovation and all those things are incorporated into that scope of work.
Okay.
Okay.
Absolutely.
That's all I have.
So, based on our prior discussions, I think we're going to review this in November. I would like you, in the meantime, to send each commissioner the performance-based contract and what that looks like, and maybe you have, has this board adopted that, but you have given, the past board has given an indication that's what they want to do?
It's been an indication.
What was adopted? Was there anything formally passed in a policy session or voted on?
Amendment number 2 to the contract, which basically stated that Clackamas County agrees to negotiate with AMR on a performance-based contract. So it's
I
kind of a,
like that amendment. I like all copies of everything that's been done that we're expected to act on. I would like also, in the beginning of this, to say what the board's duties and responsibilities are and what our choices are. And the sooner you get that out, the better your lives will be, because I'm probably going to have a session with you and staff to really understand what we're doing here. And any commissioner can ask for that. Martha?
Well, I was here the first time we went through the ambulance piece, and what you just, I will just make a comment,
Martha, can you talk into your...
what you described to me today, what you've done is a huge progress towards how the system used to work. The close integration between the fire districts and the ambulance provider. I think the whole kit thing, I mean, that's amazing. That was not ever pulled together in quite that way, and it's taken close to 18 years to get there with it. But I will tell you from past experience with this, that this is really a good, I'm really pleased that it's gotten this far. But that's just my take on it.
thank you very much.
So,
Any other comments or questions? Yeah, Mark.
I have one question. May 2024, AMR's contract is up.
Yes, sir.
Is there not a requirement to have a competitive bid at that time? In other words, do we just assume we continue to work with AMR?
So my understanding, and I'm not legal counsel by any means, my understanding is that the board has the authority to go and do a performance-based contract with AMR and continue this forward, but I don't know the intricacies or the legal requirements, so I can't speak to that piece,
Okay.
if that makes sense.
Well, Mark, I think we can make a decision whether we continue with the performance-based contract with AMR or we put it out to bid. Is that right, Gary?
That is correct. So the prior board decided, under this, agreed on this performance-based contract. Should that become the formal contract amendment, there's no expiration date, which means AMR, as long as they meet the performance metrics, could have this contract indefinitely.
Is that called an Evergreen contract?
Evergreen, correct, yeah.
Go ahead, Mark.
And is that in the best interest of the county in terms of cost?
That's a good question.
Yeah.
And how do we determine that then?
Well, I would
think
think
we
when
do
it
that
comes
through
to,
involvement, I guess, you know.
How do we determine if an Evergreen contract is in the best interests of our citizens? That's a question that I think is fair to ask, and I would like I would like multiple answers to that.
And
Just not from staff.
If I could, Chair, I also wanted to note that right now, the current process is there is the end date of the contract, and it's month to month, if AMR does not meet, if the ambulance provider does not meet those response times, those 90%, then they are assessed a fee that they have to pay the county. That is essentially a penalty. That is how this current process works around the contract. We have recommended that if we're going to move forward with a new contract with AMR, that there be a really strong programmatic and performance audit that occurs, that if they do not meet the certain standards, that extension would occur. So you could earn additional years to the contract as a base. But certainly if there's underperformance, the board at any time has the authority to change this contract as being an exclusive franchise.
Any other questions?
well,
Martha.
yeah, I just wanted to make a comment that why is it good for our citizens? As I said, I was here the first time. I'll be very direct and honest about this publicly. They always get highly politicized when you do an RFP with ambulance pieces. And trying to go through RFPs, the standard is, from my public administration, classes and background, is that, yeah, you do an RFP because a competitive bid will get you, better fiscal outcomes, okay? In other words, it opens up the gate to negotiate. That has never been my experience with these. I have found it to be draining. We go back and forth. And the bottom line is, from my perspective, from a medical view and my experience with this, the reason why I prefer this is because, I'm just going to lay out there, because of consistency in the integration that'll happen. Because these contracts, you know, what you really want is a system that's working, and that was the goal of trying to, you know, it wasn't not to go out with intent not to be competitive as much as this is ambulance stuff. And no offense, it's got to be done right. And the fire districts and AMR have taken a long time to integrate their services. There were times when that was a very poor relationship, and what I'm hearing now, I think that's changed, where they're working together. That's why this the medical outcomes to me was pretty significant, because you kind of have to start all over
I
again.
know, but
And-
it's very fair of me as the new chair to ask every
Oh,
question
no, I'm not
I
saying.
can think of. I'm not going to presuppose anything at this board, at this meeting.
No,
I do have,
I'm just giving my opinion to you.
I know you are. And I would like to hear from the fire folks too, independently. In page 1 of this, what is the cost, approximately $6 million annually? Cost of what? The contract? Because the contract is far greater than that. What is this, what's the $6 million annually for?
$6 million annually is the amount of funding that AMR received last year in order to run this program, correct?
I thought the contract was more than that.
We'll double check that number for you.
That number seems awful low to me.
That's annual, or the 10, when does this contract start? 10 years ago? The
2014.
10 years of the contract, that's $60 million, right?
Correct.
Okay. This contract, just a minute.
2014 it started, right?
Yes, sir.
2014 to 2024, 10 years.
10-year
Yep.
contract.
5-year contract.
To
with 5-year
24,
extension.
I was counting this year, not 24. Okay, any other questions or thoughts? Mark?
Just one comment, maybe just kind of respond to an earlier question that Commissioner Scholl raised, is that, you know, I wasn't here when Martha went through her first round with the prior commission back in the early 2000s, but I certainly read it in the paper. Okay. It was a big deal, right? And it got really ugly, and, you know, I hearken back and, oh my gosh, what the heck's going on? And then living through it in the second round, or the next round, living through it myself. But I think what helped me throughout that was to see the fire districts, the fire providers, those folks in support of what we were doing and where we landed. So they have a good working relationship with one another, and that's great. But you know, when they were up here, marching up here, supporting what we were doing, that really helped influence all of us, I think.
So, anyway.
After all, they're on the ground. They're the ones out there that are pulling up and responding to these emergencies, and they know their stuff, so I take all that input from everyone into consideration.
Okay.
Anything else for the presenters today? Thank you very much for coming forward, and please follow up with me on my request.
Thank you very much.
Gary?
All right, thank you. Next is approving a subcontract for infectious waste collection. We have staff from Transportation and Development, Sustainability and Solid Waste Program, Dan and Rick. Please go ahead.
Shall I wear a face mask for this? Oh, I already am.
You kind of forget, don't you, Commissioner?
So first, an apology. Chair, Commissioners, an apology as I refer back to our happy days times. I jumped the shark. So essentially, I got out ahead of the board a little bit. I had asked that this be brought forward to issues last week. That's not our standard process. Our standard process is to make sure we go through a policy session process, which we're doing today, which was previously scheduled. So with that, I'm joined by Rick Winterhalter from our Sustainability and Solid Waste Group, and we are here to discuss a recommendation from the Solid Waste Commission to approve a subcontract for infectious waste collection. With that, I'll turn it over to Rick for presentation.
Thank you, Dan. Madam Chair, Commissioners. With us today is Mr. Jeff Norton with Trilogy. So if you have some detailed operational questions, you can certainly take those to him. But as the report said, well, part of the report said anyway, in the late 80s, hospitals had largely had incinerators to take care of their infectious waste and that sort of thing. And then there were some air quality regulations that in the late 80s put a stop to that. The legislature said that infectious waste should be solid waste and put it under the control of cities and counties as with all the other solid waste. So in the early 90s, and infectious waste, are sharps, pathological materials from surgeries, petri dishes, all of that type of items. Those types of items that require special equipment, containerization, special training by the folks that handle it. Transport, storage, and disposal is all different than kind of the traditional running down the curb and picking up our garbage on a weekly basis. So at the time in, I think it was 92, the board at the time approved a subcontract with Biomed, a firm out of Corvallis, to handle that for the 27 collectors that were franchised in the county at the time. In 2011, Waste Management wanted to terminate that contract and take on the work themselves. They had a division that could, that specialized in that material, and so they went and took care of the material within their franchises in the county. And now they're considering some subcontracting with Trilogy Med Waste, who has the experience, to do this work. And it is going to be the same personnel that Waste Management has been using since 2011, which would be Mr. Norton and his team. So their customers will not see really any change whatsoever, except maybe the letterhead on the billing. So with that, the Solid Waste Commission recommended approving the subcontract back on September 18th.
So staff would respectfully request the board approve this, basically by adding it to a future consent agenda item at a future board meeting.
So are we just approving the change of the name, or are we approving a whole new contract?
It is a new contract.
Well, how much is this contract worth?
It is
So there's not an amount that we approve on this?
there's no amount whatsoever. It's a subcontract with them for operations, and we regulate the fees, and the fees have remained
Well,
the
what are
same
the
for
fees?
quite a while.
What are the fees? You regulate the fees.
Yes, we have
okay.
it is on the approved fee schedule that we have. So a solid waste collection fee schedule that we come to you every year, and
Yeah, but I don't remember seeing anything about medical waste on that solid waste fee
No, because there were
schedule.
no changes to it.
Well, what is it then?
Pardon?
What is it then?
Oh, it's a series of fees based on size of boxes and that sort of thing, ranging from $48, I think, for the small box up to.
So she's asking for what's the actual number? Do you have it in front of you? Can you
No,
pull
I
it
do
up?
not.
We can find that information.
So why
together.
are you asking us to approve a contract if you don't have a number in front of us?
So it's the board's ability to approve the conveyance of the sub-recipient contract to a different.
That's what I asked. Are we just changing the name in this? And you said, no, we're doing a whole new contract.
It's a change on who's providing the service, that is correct.
It's not a change in the fee.
It's not a change in the fee whatsoever.
It's a change of the providing.
I still want to know what it is. I still want to know
Sure.
how much
No,
it is.
well, absolutely.
This new board has not seen this issue before, and you know that.
We can provide that information for you before it goes in front of the board of consent agenda.
Evan, do you have something you want to add?
Oh,
It's posted online. I don't know if this is sufficient information for you, Chair, but,
I should not be reading this.
okay.
Yeah, so it's
To
a,
describe that we have a table online.
yeah, so there is a table online, and it is, there it is. So ranges from 1 unit in a 20 gallon box, it's at $81.45 up to per box. So that's if you pick up one, and then as you go down the line, if you pick up 90 or more, so at a hospital, that price of the box decreases down to about $12.80. These fees have been in place since, I think 2003 was the last time we brought any changes to the fees to the board.
Okay, you still haven't answered my question. I know I'm kind of being difficult, I know, but you know what? You come before us, and you want us to approve a contract. I need to know how much that contract is worth. And is it all the medical facilities in Clackamas County that do this? Okay, that's really good to know. I'm sure that there is a base amount to this contract, or that gentleman wouldn't be sitting in the back of the room, because he probably knows the answer to my question.
It is the base, it is the fees that the board approves
So
are,
the fees haven't changed.
Which generate how much money a year?
but I really couldn't tell you. I'd have to look.
Yeah.
I think that's what the chair is
What they
looking
are,
for.
yeah.
Okay, we can look on the franchise fees.
When is this due? Is there a time limit? Is this time sensitive?
We would like to have it approved, yes.
When is
The
this due?
subcontract is in the works right now with the
Okay, you
companies.
still have,
So,
we're not going to approve this today unless I get two questions answered. Number, when is this due? Is it time sensitive? You can't seem to answer that. You can't seem to give me amount of how much this contract is worth.
so let me make sure I'm hearing your question correctly. So it's not a contract in the form of a contract for amount of money to perform a service. It's an approval in the ability for an entity, meaning Waste Management, to subcontract with another provider to provide the service. That service then was provided by that subrecipient, and the amount of money that's associated with that is dictated by the service they provide. So, and which is dictated by the fee schedule that you have in place.
So there's a history, right?
There's a history on yes.
Okay, so what was last year's fees?
We don't separate those out.
The fees have not changed.
The fees,
The fees are
That's not the question I asked, I asked how much was you said there was a history. Well, then last year, you know how much was collected, and the year before, you know how much was collected, correct?
yes.
Well, then what is that figure?
I do not know, to be honest.
Okay, we're not
I
going to
have it
approve
back at
this
the
today.
office.
We are not going to approve this today until I get these two basic questions answered. I don't think my board knows the answers to these questions, but it's all in full transparency and disclosure. Martha, you have something you want, oh,
Yeah,
excuse me.
yeah. Oh, who goes first?
Mark, you're up.
Okay. Waste Management of Oregon subcontracted this medical waste piece out. They brought it back to them again. And now they want to subcontract it out to Trilogy, using the same personnel that Waste Management of Oregon used when they had the subcontract back to them. I don't quite understand why they're doing that. Is it because this medical waste thing is not profitable enough? And then the next question is, in paragraph 3 of the subcontract agreement, there's a piece in there about rejection of excluded waste. Would Trilogy have the authority to reject that? What is that kind of waste that they would have the authority to exclude from pickup, and how would that affect the customers throughout the county who depend on having that medical waste picked up?
That is a great question, Commissioner, Madam Chair. I think that would be a question for Mr. Norton. He could definitely answer that question.
Mr. Norton, you want to come forward and answer that question? And please repeat it again, Mark, more succinctly.
I think, Jeff, you got the question.
Good afternoon, Mr. Norton.
Good afternoon.
In the paragraph 3 of the subcontract agreement, it talks about rejection of excluded waste.
Correct.
And my question is, what would constitute excluded waste? Would Trilogy have the authority to say, we're not going to pick this up? And then how would that affect those 27 customers throughout the county that depend on having that stuff picked up, whatever it might be?
So excluded waste is really stuff that's not under the definition of the medical waste. So there's a code, Oregon State Code, that lists out what medical waste consists of. So if our driver, say, gets there and sees that there is a vial of epinephrine which is a P-listed hazardous waste or something like that, that falls under hazardous waste, we don't pick that up. And if it's mixed in with the waste, it overclassifies that waste stream, so we do have our drivers the ability to exclude that. And so the customer, what we do is we don't just leave them high and dry. We would tell them, hey, we take a picture, we usually take a picture, and then I'd have to follow up, or our rep, and say, hey, you need to, separate this out. And then we'll come back and pick up the medical waste.
Okay, and one other question. Once Trilogy picks up this material, is it Trilogy's responsibility to incinerate it? How is this material ultimately disposed of?
So, yeah, there's a couple different options for medical waste treatment. We currently take everything to Brooks, Oregon, to the waste-to-energy facility for incineration. In the past, and I'll go back to a comment you made earlier too, with Trilogy and Waste Management, what Waste Management did was they got into it. They were going to be going to this national business, step back, didn't work, wasn't their core. They sold their assets to Trilogy. But the personnel all stayed the same. It's kind of a, we're still partners with Waste Management on certain levels. We can take our stuff to their landfills and whatnot. But we're a separate company. But I have all the same team that provides the services. And then what was your question again? I'm sorry, I got sidetracked.
Well, the first question had to do with the why Waste Management of Oregon had subcontracted out the medical waste piece, took it back.
Yeah.
And now is subcontracting it out again using the same people that Waste Management had doing it before.
Right. So originally, they were never in the business in the early 90s when they subcontracted to Biomed, which Biomed was acquired by Stericycle, which is another player in the market. And so then when Waste Management did, on a national level, want to get into the business, they said, well, let's take advantage of our service, or our franchised areas that we already, our certificated areas we already service, because we can service them direct now. We don't have to subcontract. And then consequently, in late last year, they made a deal with Trilogy to get out of the business completely on a national level. Trilogy took over the assets, and so now they're basically re-subcontracting it to Trilogy. But again, it's the same, we have the same drivers, same management. The one thing that has changed is that we're autoclaving the items in Seattle. Most of the items, about 80% of the waste is autoclaved and then landfilled. And since then, we've made a decision to take everything for incineration. And there's a couple reasons for that, but that's what we're currently doing. We might revert back to autoclaving some of the waste at some time, but as of right now, everything is incinerated at Brooks, Oregon.
Okay, thank you.
Paul, excuse me.
Yeah, so I'm just trying to understand, this is, we franchise two things. We just talked about ambulance, now we're talking about waste management, so forth, waste services. And so I want to just say this for anyone listening. Basically, the reason those two are basically franchise is it basically assures by the winner of the contract has an obligation to provide the areas that otherwise wouldn't be served if they're out of area, not efficient to serve. And you'd have basically the urban core, which is sufficient to be served, and the outlying area is not served. So that's the principle of why we franchise. Okay, to make sure that the outreaches of the county, the internal, everywhere is served. And granted, there's different rates for some of those geographically. So that's the principle. So in this particular circumstance, just building on the last conversation, does the subcontract opportunity here is that something that it goes out for bid, or is that something that could go out for bid? Whose responsibility is it to make sure that there's a competitive opportunity, or is that even an issue? Is that solely up to the discretion of Waste Management in this case? Whose call is it?
Commissioner Savas and Madam Chair, that is at the county's discretion. So it is the company, the franchisee that we have authorized to serve the area. They can choose whom they want and bring a subcontract forward for the board approval.
Okay, so that's what we're doing today.
Yes.
And one point of clarification is to make sure, whose responsibility is it to ensure that subcontractor is meeting our needs?
It ultimately lies with the franchisee.
Correct.
Right.
In our oversight.
Okay, I have another couple more questions. Sharps, is that considered waste?
That is considered medical waste, correct?
medical waste. So it's devices along with the other stuff you described.
Correct.
Okay, you refer to this as a contract. You go back to basic law, and there's certain elements of a contract, and consideration is one of them. Consideration is your monetary amount. I do not think I'm out of line by asking for that. And second is the date, which is also an essential element for a contract. So if it's not a contract, you need to tell me that, oh, this is just something else that we're going to approve. So I would like you gentlemen to come back at a time when you have these questions answered. Sonia?
So I'm just trying to understand this too, studying, listening, taking it all in, listened in the car on the way that I was here. So I just want to make sure I understand that this, you're before us today because you want our approval to allow a, what was called Sub-Recipient Agreement, just to allow contracting with Trilogy, the waste management's contracting with Trilogy for medical waste. Is this at all controversial?
No.
Okay, so I don't see, I don't think that this is a money necessarily issue. I think this is just us producing, us acting in our role as overseer to say, is this okay? And I've just been, if you watch me Googling here, I'm looking at Trilogy's website, looking at where they are, looking at all the different types of things they do. It's a lot. And also looking at waste management, just sort of getting the lay of the land. I don't have a problem with us moving forward and allowing this to happen today. I don't need information regarding all of the fees, but I think it is important for commissioners to know, we approve those, we go through that process, we interact with our solid waste commission. I'm okay moving forward, but I'm okay waiting if this isn't urgent so that just every commissioner has the depth of understanding that makes them feel comfortable moving forward.
We've had a request, and I just want to make sure, Chair, that I'm clear on what you're looking for, because right now, as we said, your question is valid. What is the value of this contract on an annual basis? And that value, unlike normal contracts, again, will vary annually, and we can bring back those numbers to you.
But you have a history, Dan.
Yeah, yes, and we can get that data for you. Yeah. But I'm telling you that it's going to vary on the amount of medical waste that was collected any given year. And so the rate's the same, but you may have a year where you have higher medical waste collection. You may have a year that has lower medical waste collection.
I understand that. That's a business model.
Yep. And I'm just.
Some years you sell more trivets, and the next year you don't sell as many
Correct.
trivets.
You sell widgets.
This shouldn't be that difficult. My questions shouldn't be that difficult.
They are not. You can find that information.
All right, good. Gary, what's up next?
So we're going to pull this, and please come back. If you could do it as soon as tomorrow with your staff report, you can be back next week, otherwise the week after, and come back to a policy session.
We'll see what we can do. Thank you.
Thank you. All right, we're going to move right into the next session. It is the Performance Clackamas update. So Commissioners, we are starting to update you on your Performance Clackamas goals for Clackamas County. There are 10 of them. They are on this beautiful pamphlet that's on your tables in front of you, document. And today is the first of that update, and we'll do this every quarter with you on each of your 10 goals. Staff will tell you how they're doing on reaching progress of your goals and then answer any questions you may have. So today's is on your Performance Clackamas goals on the Sunrise Project, which is, I'm going to read it, by 2024, funding for the next phase from 122nd to 172nd of the Sunrise Gateway multimodal corridor improvements will be committed from federal, state, regional, and local funding sources. We have staff from Transportation and Development, Dan and Jamie, to give you an update. Go ahead, please.
Thank you so much. We're going to load up the PowerPoint here in just 1 second. We have a lot of good information to share. Don't want to miss any of it. Obviously, you have a packet that has the PowerPoint in it, and it also has the supporting information, which is basically the Performance Clackamas Report Out document. Thank you very much, Shannon. Next slide, please. So we are here today, obviously, to talk about the board's strategic results, which Gary just read off. An update since we last met. There's been a lot of information, a lot of hard work going on to try to achieve this board's goal. A discussion about the visioning plan. If you recall, this is a review of kind of our legislative proposal we put forward. Discussion around desired outcomes and next steps. Shannon, if I could get the next slide, please. Thank you. As Gary just read, by 2024, funding for the next phase from 122nd to 172nd of the Sunrise Gateway multimodal corridor improvements will be committed from federal, state, regional, and local funding sources. which was adopted by the Board of County Commissioners. Keep in mind, I mean, this is something to be focused on. This is not our facility, not our road, but it's a priority from the board to serve those areas, those greenfield areas to the east, not only from a residential perspective, but also from a business and industry perspective as well. So with that, I have the pleasure of being joined by Jamie Stastny from our group, and I'm going to hand it over to her to kind of continue the presentation at this point in time.
Thank you, Dan. Good afternoon, Chair Smith and Commissioners, Administrator Schmidt. Jamie Stastny from DTD. Good to see you all. Next slide, please, Shannon. So since we last met, actually when we last met, you all approved the Sunrise Corridor Community Visioning Plan as a legislative priority. And you'll recall that that legislative priority was also supported by the Clackamas caucus. This resulted, it was great, a lot of great work went on, a lot of synergy around this proposal. It was supported, and it resulted in the legislature voting to approve House Bill 5006, which included $4 million in funding for the Sunrise Corridor Community Visioning Plan. In July, the staff worked to develop a strategy for next steps. We convened a series of internal partner meetings to develop and refine desired outcomes for the study. In August, we confirmed internal consensus around these desired outcomes with our implementation team members and other internal partners, and we also agreed upon next steps. So this slide just shares with you the legislative proposal, which is in the full version, is in your packet. Just a reminder of the document that we use to work with the legislator to get this project funded. Next, please. And essentially, we have developed these outcomes. So the first and overarching outcome is to create a master plan that's centered on equity with actionable policies that will guide future decision-making to support a vibrant, safe, affordable corridor that serves existing and future community members and the region as a whole. We're planning to accomplish this by identifying stakeholders, collaborating with the community and other partners to build trust and identify challenges and opportunities, compiling existing plans, of which there are many out in this area, inventory the community strengths and resources, study the existing conditions, develop the plan, accept the plan by public process, and implement the strategies to support the plan. Next, please. So this overarching outcome breaks down into 5 pieces. They're basically separate components of the plan. The first is overarching as well, which is equity-forward community engagement that results in long-term mutual trust. This has been I would say one of the key pieces that really needs to happen in this area to engage the community and find out what their lived experiences are, what they need out there. Also building trust and building relationships out there with them, with CBOs and other people in the area. Economic competitiveness and employment land analysis and implementation plan. It's going to be really important for us to look at the employment lands out there and make sure we're enabling them to develop appropriately. Also, we're going to be doing a land use assessment and implementation plan very closely tied to the economic competitiveness and employment land analysis, a community health assessment and implementation plan, and then 4 separate infrastructure assessment and implementation plans, including transportation, water, sanitary and stormwater, parks, and open space. So all of these really important pieces. So with that, there is a slide there's a separate document in your packet that contains a summary of those desired outcomes with more detail. If you would like to look at those, we can go through them, but I pulled them out of the presentation to make sure we're concise for our time today. So just letting you know some funding details. The funds are ARPA funds. So they came through House Bill 5006. They're state ARPA funds. They will be awarded to us through ODOT. It will be similar to a grant. We'll have an IGA agreement with them. So as with all the ARPA funds, we're still awaiting the fund guidance and timing information for when these funds will become available. So we're still waiting for that. We're not losing time. We have a lot of work to do to get ready. So we're using this time to prepare that. And so we have a lot of next steps coming up, but in the the immediate next steps in coming months will be to meet with our external partners. So as you know, we have our implementation team, which has many different departments through the county who are working together. We also have all these external partners that we need to work with to build alignment on the desired outcomes and the draft scope as it comes along. Happy Valley, ODOT, the water service providers, Metro, TriMet, and other transit providers. We'll be forming an internal working group, a smaller group than the full implementation team to start to build the scope, which will be built on these desired outcomes that are in your packet. And next, we'll be determining the procurement path. probably an RFP, and we'll be working to develop that so that when we know fund timing, we'll be prepared to work with procurement to get this all out. So that is it for today. Kept this fairly brief, but I'm happy to answer any questions you might have about our project.
I guess I might interject just one thing. In your packet is the MFR document that's standardized for all these procedures. It has a very detailed list of our partners. We have Development Agency, Public and Government Affairs, H3S, WES, BCS, and Board of Representation. Identify some key strategies. Related metrics are here as well. It has a comprehensive list of activities completed to date. So if you have questions about that, what work has been done to date. And it also has this quarterly report on how the work is going to move forward in the upcoming quarter. So I just wanted to share that with you. And, you know, there's a list of what's working well, barriers and challenges that we can have more discussion upon. And last but not least, there's this discussion around changes recommended due to COVID, which we have none. There is no recommendation right now that we have regarding that COVID interaction today. So we'd be glad to answer any questions you might have.
So as we go forward with this, at what point do you notify the landowners that this is happening?
Well,
All the property owners in the area?
that would be a discussion in our public outreach plan and how we provide that.
And when does that happen?
That has not been developed yet.
So I'm concerned that the people who are affected most by this will be notified last. And I think maybe more than one notification is in order. And before we even get started on this, I think every landowner in the geographic area needs to know that the county is doing this based on funds from the legislature. It's a priority and da-da-da-da. And you will be affected. I mean, I don't know what the effect's going to be. We're all hoping it's going to be good.
Mm-hmm.
But, so I think that's really important.
I think you hit the nail on the head on one of the objectives and outcomes we'd like to see from this process is not simply us coming forward as a whole and saying, hey, the sunrise is great, let's support it, but to have the community out there saying, we want this project and here's why we want this project.
I would really like to have that done in any CPOs out there. Is there a Damascus CPO now? I think somebody said there was, since we don't have a city of Damascus. And there's got to be other groups. Is there any other Damascus organizations like, of course, there's not a chamber, but there's the North Clackamas Chamber would be one. Mm-hmm. Any other civic groups, Lions, Rotary, any of those folks, we have got to bring in these people and make sure they're a part of this process.
And equally important, even those groups that we haven't historically connected with.
Yes.
There's discussion around like the school districts and the interest there and the services they're providing to the children in that area.
Yeah.
It's how do you build those?
When you consider along Highway 212 from 205 up through Highway 212 to Damascus, all of those businesses, in my opinion, need to be notified that this is moving forward because we have to have the buy-in of everybody out there, and we can't have, I don't believe that we can have the thought process that, you know, we're government and we know what's best for y'all, and when we don't, I mean, we're not, that's not the goal of this. I know that's not, but that's how we could be perceived if we don't go forward in that area. So I think that needs to be first up. All this stuff is really good. It's wonderful, blah, blah, blah. Paul.
Yeah. Thank you, Chair. Yeah, I'm really excited that we got this money to kick this off. And you kind of hit a key thing here I wanted to bring up here, and that is that, and just correct me if I'm wrong, but this is approximately from 122nd to 172nd. That's the geographic area, and a little bit beyond, or can you just define, when you talk about the community, who is the community? How far outreaching will it go?
If you look, I'm not sure, I think you have a color on your screen. I'm looking at the black and white one, so it's not my eyes. But it describes a geographic boundary that we're kind of looking at, which is more extensive than simply that localized area.
Right.
It goes all the way over. I believe the west side is 205 for the most part.
Yeah, you do have 205 down to the Clackamas River to the south.
Yeah.
Okay, so we're around the red, we're out within the red.
Yeah.
I believe it is red, correct.
Okay.
Yes.
And, you know, I know the area pretty well, and if you actually look at the map, which is my point I wanted to bring up here, is that there's really not a lot of residents in the area. Really not. I mean,
No, but there's a lot of land.
there's a lot of businesses.
Yeah.
And there's more employees, which is my point, there's probably more employees and the related businesses than there are population of residents in that area. Just wanted to mention that. And those that are residences, you know, we have a mix of some mobile home parks, low income, and you have some along the Rock Creek 224 piece that are more suburban, you know, more average income of the county. So you got a mix there. I'm hoping, and you know, we had a discussion earlier and having discussions with the community along McLaughlin and the Park Avenue thing, and something, Dan, you know, you and I have discussed, is that I really felt after we got out of phase 1 of the Park Avenue and phase 2, I really pressed really hard for ensuring that we got the businesses actually involved. And I don't want to fall short on this one. I really, and it's challenging to get the business owners, and sometimes the business owners aren't the landowners, but, you know, we've got to realize that distinction sometimes.
That's right.
But, you know, they're tough. They're a harder nut to crack. You just can't walk in the door and knock on the door and say you did your job and you contacted the business, because really you didn't really contact. I just tell you, from cold calling myself, you press and press and press until you get the right person.
That's right.
And that takes work. And when I asked for the log, or who did you contact, who did you talk to on the Park Avenue, it was just crickets in the end. So I just want to make that statement. I never got a log of who was contacted and when, and so on. So that's something we still need to work through in moving this forward. So just want to mention that. And the other thing I wanted to mention is that the word on the street is that perhaps Metro might try to seek another 2020 type measure. And is this project going to be completed by then? So it'll be ready for consideration.
I'll answer, and correct me if I'm wrong. I don't have any clarity on whether or not Metro is going forward with another measure and or when. We have heard talk. I have heard no confirmation of an exact time or framework around that. Will this project be done in that amount of time? I can't answer that question at this point in time, because not knowing when Metro is going forward. I think that you may have something that the project that we currently had in, it's a double-edged sword, to be honest, Commissioner, because the dialogue that we had when we developed that Metro project, it was something less than what the original environmental study did for the Sunrise. If you recall, the Sunrise at one point in time was really 8 lanes wide and mowing down through the middle of that. That's not the project that's going to be able to get built. And we took a very conscious effort to develop something to right-size that. That's just internal work to right-size that. There was not a lot of time for public engagement around that. And so the dialogue is making sure that we build that public around a project, maybe present that project and see what their thoughts might be on it, but make sure that that's right-sized and what that community feels they need. And so I think you lose some of that if we get too far out in front of our local process, if we just put some other project forward without vetting it through the community. That we'll have to come back to the board and have a discussion with that if that presents itself. Because, again, we would hate to lose that opportunity if Metro chooses to go forward again. Go ahead.
Yeah.
Build on that.
Yeah, I will. Thank you, Dan. I just add, we are working closely with Metro on this. They were such a part of the T2020 project, so we're staying in communication with them to make sure that if that does come to fruition, that we're prepared and we're working together.
Yeah, well, great. There's a lot of development potential here. There's a lot of land that is greenfield it's really ripe. And, you know, we're a bedroom community. Our jobs to housing balance is out of whack compared to our other two partners, or counties, that is. And this has been a big deal for me personally. I just put it out there. I mean, there's no secret that we make some traction on this, because it was really part of the county's economic development for years. And this is just one piece of it. You know, it was envisioned to go all the way to Highway 26,
Yeah.
the original Sunrise plan. And we've broken down into phases, and we got phase one done, so to speak, which was literally the road. And now we have phase two, which gets closer to some of those green fields and the development opportunities. So there's just a lot of potential here. And we have a lot of safety issues as well, so we have a lot of needs. So I'm really hoping that the community can build on that and share that, as well as a lot of environmental assets with the river and so forth. So I'll stop there.
Any other comments from commissioners? Gary, what action are we taking on this today?
None, this was just an informational update.
Great, thank you, but,
Thank you so much.
yes, appreciate it.
Thank you. That concludes your policy sessions. We're going back to the issues list, and you have some meaty topics to discuss, and we have up to as long as it takes for you to talk about it. So first item is Administrators Housing Task Force update. Commissioners Schrader and Savas have offered to provide the update.
Paul, you can kick her off. We did, I think everybody has this handout, do they? No, they don't.
It's not really a handout. I was just going to read it.
It's just more of a talking point.
Yeah, I was just going to read it.
Okay, go ahead.
So, yeah, well, thank you.
Do you want to look at it? Go ahead.
Yeah, I'll just read what I have here. Prior to the BCC recess, the task force decided to invite Councilor Christine Lewis to our next meeting, to assist in the understanding of the technicalities of implementing the LIP and meeting the expectations of the Oversight Committee. Last Thursday, Councilor Lewis joined us as we reviewed the existing LIP rollout, and we discussed the new financial information we learned on a meeting we had on August 26th, and I'll talk a little bit more about that. The staff of the 3 counties have been working diligently on the IGA, and in fact, today and tomorrow, there are negotiations amongst the counties and Metro to help finalize the IGA. Once the IGA is finalized and signed by all the parties, we will then be able to better respond to the questions posed by the Oversight Committee. And housing staff have done a great job in responding as best they can. Did a pretty good job of responding to the questions raised, but it's not really complete. The IGA, again, completion will help finish that off. This is important because ramping up the LIP rollout is dependent on identifying new revenue and funding, and any additional advances are dependent on satisfying and answering the questions raised by the Oversight Committee. Once both are achieved, the task force will bring proposals and options to the BCC ourselves for us to discuss for discussion and approval. We have confirmed, despite information otherwise, that Metro is actually not offering Clackamas County a $24 million loan. There was a rumor to that effect. I've made contact, and that's not the case, and I'll explain a little bit more. On August 26th, our CFO, Elizabeth Comfort, and I met with Councilor Christine Lewis, the Metro CFO, Brian Kennedy, Mr. Stoll, and Angela Martin from Here Together, and we learned from the Metro CFO that the Portland Energy Tax modeling contained in their May communication to us is not a usable guideline for revenue forecasting, which explains why the revenue disbursements have been well below all of our expectations. I also use that opportunity to reinforce that Clackamas County is committed to rolling out the LIP as funding is identified. We also learned from the August 26th meeting that the Metro CFO and Here Together leadership are very confident with their $24 and $36 million forecast for late fiscal year 2021-22, which is May, June of next year. The following day, I was struck by that. So the following day, on August 27th, I sent Mr. Stoll a request for financial calculations and resources he cited from Eco Northwest that generated the $24 and $32 million forecast. And so we are awaiting that information as well. Commissioner Schrader and I are committed to implementing the SHS LIP. However, there are 2 hurdles that must be cleared. Therefore, we sincerely hope that the first IGA negotiations are successful, the IGA negotiations aren't successful and the IGA is signed soon. And second, our staff can then address the Oversight Committee's questions to their full satisfaction. Once those hurdles are cleared, Metro will be better prepared to entertain and advance, if needed, beyond the 5 million. So what I got, let me explain that a little bit further. What we heard, and Martha heard this as well, Commissioner Trent heard this as well, is that if we want to submit a request for a more advanced beyond the 5 million, we would be able to do that, but not likely will it even be accepted until we clear up with this oversight committee any of these misunderstandings. That, again, is dependent upon the interpretation of the IGA, which is under negotiation as we speak. So those two things cleared up, we have a green light to submit a request, if needed or when needed, for any other advance. We don't know that yet. Lastly, when we receive the financial calculations from Here Together and Metro, the task force can then better forecast how aggressively we are able to ramp up the LIP rollout. When the task force completes this work, we will bring back options for the BCC to consider. I think that request was made, well, it was on August 27th. I have not heard anything, so I will ask my staff to follow up with Mr. Stoll and Here Together to get that number. And Christine Lewis from Metro confirmed on Thursday that she would have help direct her staff to get it to our staff so we can go through those numbers. We just need to make sure that while they're very confident in the $24 and $32 million numbers, their auditor says something different. And the auditor report, and I encourage you to go back and read the auditor report, there's a couple of things that stuck out to me right away. But there's a range there, and so we don't want to get ourselves on a trend where we're spending, let's just say, 24 million, and if the revenues actually turn out to be 18 million or 16 million, then we're overspending and we'll never be able to actually pay the advance back. So we've just got to be whole. So I think roughly, I think that kind of covers it. Martha, you want to add anything to that?
Well, I think that the key point that I want to make to folks is that we're fully committed to implementing the LIP. It's, to me, more of a cash flow timing problem. And my understanding up to this point, we've, got $300,000 from Metro? Do you know what the number is on that poll?
120,000,
Yeah, we got 118,000 for this last disbursement,
Right.
and the one before that was like 250, I think.
Right, so we've gotten a little over 300,000. And so it's really not not wanting to do this. I just want to make that clear to all the advocates because I'm sure we're going to hear from them pretty directly.
Yep.
And I think that I keep asking them to please let us do our job in a way that makes sure that we are fiscally working towards sustainability with these services. Because if we put ourselves in a position of, in my mind, borrowing before we have certainty of the revenue stream, that's just something I can't get to. I mean, maybe you can blame the other Schrader for teaching me something like that. But the bottom line is we will do everything we can to implement. But we've got to do it in a way, and I know it's a humanitarian crisis out there. I've never disputed the fact that it was a humanitarian crisis. And what I'm hearing is that, I hope Commissioner Smith may jump in, it seems to me that your conversations with, or Chair Smith, the conversations with your other colleagues, chairs, that they are kind of in, with the IGA negotiations, they're in kind of the same place we are.
Yes.
It's gonna be important. So-
Yeah, weekly I meet with the chairs of the other two counties, and we are committed to adhering to the voters' intent and the language that was originally passed. And there's attempts to do otherwise, I think, from some Metro councilors, a few Metro councilors. Christine Lewis has been, again, very good in watching out for the best interests of Clackamas County and understands. There's been some attempts to take this money and use it for sheltering only. That doesn't solve our homeless problem whatsoever. And I think that the bill of goods that was sold to the taxpayers who passed this, by the way, this measure failed in Clackamas County, and I'll never get tired of saying that, was that we try to get a solution for the homeless situation out there. Putting people in shelters is not a solution in my mind, and I don't believe our board believes that either. We are committed, the chairs and running our own housing programs. We are not interested in Metro stepping in and taking over, which I suspect they are wanting to do badly. I suspect that the organization here together is politically motivated. I mean, that's how they started, by putting together a political plan and campaigning to taxpayers and convincing enough people inside their Metro boundary that, oh, the sky is falling, you must raise your taxes to do this. And then they found out, gee, even Metro's own audit report, as Commissioner Savas said, they're falling way short. And so I think we need to be careful that going forward, we don't spend money that we don't have. Oh, boy, we did that. How many people did we hire last year to implement this plan, Gary? 4?
4, yes.
4. Oh, we already did spend money we didn't have. Excuse me, and we're not going to spend any more. And I'm going to be very steadfast on that. I don't even like the fact we had to borrow $5 million to do this, because that was a situation that happened before I became chair. If I had been chair then, that would have never happened. So anybody out there listening, let there be no doubt where Clackamas County stands. I fully support Commissioner Savas and Schrader in their good work. Our staff has spent an exorbitant amount of time, extra time that is taken away from other, I believe, other important duties that this board is charged with. And frankly, I'm growing weary and I'm growing tired of the shenanigans that Metro and Here Together are put out, because it is a waste of time and money. Commissioner Savas.
Yeah, well, thank you. I just want to add is that the framework for this, when I go back and read some of the documents, maybe Commissioner Fisher can add to this. The stuff that I've read thus far, I haven't read anything, and I'm really excited for completion of this IGA so we can actually understand that definition, is that the oversight, the role of the Oversight Committee is to review the LIP, and the LIP is really based on the dollars, on how the dollars are spent that are collected from the tax. So technically, if that's still the framework, that's about $450,000 this far, right? Because that's what we've collected from this per housing services tax. That's what we received. So though the LIP says, you know, basically, I think it was forecasted, again, if you go back and listen to the April 13th tape, you won't hear anyone say that all 3 counties needed to borrow about $150 million collectively. You won't hear that, because what you'll hear is people saying the money's going to show up on July 1st. We need to be ready. We need to approve this LIP. So, you know, $200, $300, $400,000 is not very much money, doesn't go very far. And we're doing the best we can, and we went so far as to borrow, you know, or take the advance from Metro for $5 million. And because those revenues are a lot less than we thought, as I told you, we would report back in September, October. We're not quite there yet once we get these financial numbers, but for the final report, for the quarterly report, that'll hopefully happen in the next 2 or 3 weeks. Then we'll be able to better forecast where we're going to go. But I'll just tell you that I thought we'd have a lot more collected from disbursements thus far, based on what the Metro auditor, not Metro auditor, but the Metro CFO had indicated in his May communication to us in writing. So we use that. Our task force staff, H3S staff, HAC staff used that earlier on. Based on a $32 million or $24 million number. And so those monies they just haven't arrived. So we just gotta, you know, we've just gotta patch this together. And I suspect that the $5 million advance and what we've contributed thus far in resources will not make it through the end of the year.
That's problematic, isn't it?
Yes, it is.
When is the next payment due, Paul, from Metro?
The disbursements come monthly.
Are they
Yeah,
monthly?
so you know, ideally they start ramping up, but I guess the technicality that I learned, and I learned a lot at the August 24th or 26th meeting, and that was that you know, they're putting a lot more confidence that the tax deduction becomes mandatory in January for the employers. So it's a mandatory tax deduction. Right now it's voluntary. And so people can choose to prepay their taxes down. And so there's an employee tax for people that make $200,000. Is it $200,000 or higher, or $150,000 individual?
It's 200 for family, for joint filers, and I think it's 125 or 150. I
150.
can't remember. Can you believe it? I can't remember.
Yeah, I think it's
Single.
it's 150
Sounds like that,
for a single filer, and it's 200 for a joint filer. So then there's also the business tax, and there's also that double tax thing, which I think is why the auditor had said the collections may be a lot lower than anticipated. So when I get the numbers from Mr. Stoll, and I get the numbers from Metro, I'll have, at least personally, Paul, will have, some confidence in what that collection really will be come the end of the year, the end of the fiscal year, May, June. And if it's close to the 32 million, that's great. That'd be really exciting. I mean, I might be more inclined as one person to ask for a greater advance to get us through to January. I asked then at the August 26th meeting strongly, continually, not just what they anticipate the monthly disbursement to be in January through June of '22, but I also asked what they forecast that the monthly disbursement will be from July 22, August 22, September 22, and going forward, because that's just, trying to get a sense of that. There'll be an annual lump sum that'll come every April 15th when taxes are paid. That'll be one piece of it, but that monthly is a big part of what we can advance and what can be basically paid back. Then there's also the money that needs to be returned to Metro, 5%, I believe, that needs to be returned. That's not even calculated into our numbers as well. So I will. I think I've said everything I need to say.
So I just want to add something here, because I've talked to Bob Stoll quite a bit too, and I like him very much, and I think he's a great lawyer. And I think that he is a humanitarian, and I do think we are in, regionally, a humanitarian crisis, which is why this is a political lift for this commission, because our residents were too beaten down by COVID and by fires and by other kinds of things, I think, to really feel secure in voting for something like this. They did pass the sticks and bricks piece, that much they did, so people recognize that there was a physical capacity issue. And I was worried, knowing this county like I do, that a campaign of that kind from folks who are a little more external to our county, I honestly don't think they understand the kinds of dynamics that we deal with here. And I've said that. I've been very direct with advocates. I've been very direct, and we have always given to our advocates in this county. I know there's been some turmoil over that, but I think we've been really generous. But the other piece of it is that, remember, we have, 7 projects? And I suppose if we decided that we didn't want to do the courthouse, we could probably figure out a way to. But when you're talking about those kinds of capital construction needs that we have committed to, we can only go so far. And there's other construction projects. You're the one that gave us a list of them, Tootie, if I recall.
Yeah,
So those are those kinds of things,
But
yeah.
Martha, those are, there's more issues out there than this issue. In Clackamas County, we are extremely diverse in the things we offer. We offer more programs and more opportunities, I believe, than Multnomah County certainly does. This commission is much more diverse in what we have to deal with. We're not a 1-trip, 2-trip, or even a 3-trip pony. We're about a 65-trip pony, and frankly, it wears on us. So those construction projects have been somewhat committed.
I
We have the
know.
libraries that has been committed. We had to do a courthouse, even though
That's
that,
a death trap.
yeah, there was, so we have public safety needs, we have road needs, we have all kinds of other needs out there besides this, and this is, housing is a single priority along with many other priorities in our county that we deal with. And you're right, we have to do all these other things.
Yeah, but I think this is, I guess what I'm going to say, despite everything, in my original, I was worried about this from the get-go because I've been doing this a while, and the outcome didn't surprise me, but I still think because of the crisis, we have to figure out a way to do it. And I just want to let the advocates know they're going to hear this. They may get very angry and upset, so be it. I'm ready to take the tomatoes, but I'm going to keep saying what I've been saying to them. Please give us the space and the time to work this out. We got to get the IGA done. We are committed to the LIP. We've never not been committed to the LIP, but we can't. We can't grab money from the air right now. We just can't. Mm-hmm. And if we get criticized, frankly, because, well, we're just not, using our reserves and so on and so forth. But like I've pointed out, wildfires, the projects we've already committed to, it puts us in quite a bind. And I think, for me, I have to be realistic about it. But I am fully behind implementing this. I think we all are, really, despite the hurdles, but just please let us do our job to move it forward. And I trust Commissioner Savis's abilities with numbers. I think he's asked all the right questions with cash flow things, and we'll see what answers we get. So that's just my perspective on it. So if I need to bring in a basket of tomatoes, I'd be glad to. I don't know what to say to people. But.
Yeah, it is a cash flow issue. We do have to be mindful. We worked too hard to have a sustainable balanced budget, and I don't want to take a retreat on this, really for failed promises of a tax revenue. Commissioner Fisher, you've been very patient.
Yeah, thank you. So, Paul, thanks for the report. I really appreciate having the notes in writing. That's helpful to look at those. Just a couple of things to fill in the blanks for me. You had said to take a look at the auditor's report, to look at what the auditor had suggested. I just want to make sure we're on the same page. I'm assuming you are looking at the two different funding scenarios, and on the low end, the auditor had said it would be between 13.9 and 14.7 million, and on the high end, it could be between 39.8 and 42.1. Is that what you were talking about the big delta between the auditors?
Yeah, that's part of it, yeah.
Okay, so I wanted to make sure that that's what you're referring to. Okay, thank you. And then in your report, you had said that there were new numbers from the August 26th meeting, or new calculations. What was that? Or new financials? No, I don't have the report. I'll look at it.
Yeah.
What are you referring to there?
Well, I think maybe it was what the part about what I had heard was, I'll just repeat it, is that if you recall, we got the letter from Metro, 2 or 3 page letter in May saying the monies, aren't really going to be coming like you think. Mm-hmm. Follow the Portland energy tax model. Mm-hmm. You had that graph that went like this with the collection. Gary set up a contact so I could contact Mr. Kennedy for the first time. I sent him a very nice email. He replied back, saying, please, I asked for, give me the best case, worst case, of what the monthly disbursements may be. And his response, paraphrasing here, his response was follow the Portland energy tax, look at the letter, basically the same letter, follow that. So we followed it. And previously, Jill and her staff also followed it, Vahid, and they followed it, but they used the high number, and they came up with about $2.2 million a month starting in July. Okay, that was prior to my letter, right around the same time. So when I got the letter back, Everett, myself, and others, we calculated, that was right about the time that Gary authorized the task force group, Martha and myself, to start looking at the numbers. And we put together an estimate using that. So we would have gotten, let's say, $460 million 1 month, either July or August. We would have gotten like $200-something thousand in June, July, and there would have been this, following that model, we would have been each of those have been substantially lower. And so what I learned, getting back to August 26th, was Mr. Kennedy said, don't use that, basically. It's not going to work. It's not applicable, even though it was incorporated in the letter, and I think we pointed that out. And so I said, well, that means that our financial modeling, our cash flow modeling that we worked on, and I literally said these words, I was just going to toss it out the window because it's meaningless.
Okay, so so you did explain that. So that makes sense, I think. But so that was your conversation. There aren't any other updated forecasts coming from the auditor, from the CFO from Metro?
There's no new numbers they've produced,
Okay.
but Mr. Kennedy, and I hope he's right, has stated that he's very confident. I say this with respect. I think he's very confident about the $24 and $32 million forecast. So all I said was, and I repeated this to Councilor Lewis.
Wait, can I just stop you?
Sure.
Where is that? Because
Where's what?
the 24 to 32, I'm looking at Metro's, it's 39 to 42. The 24 to 32, was that based on the energy tax?
The May 20 letter.
That was based on the energy tax?
No, not based on the energy tax. That was the cash flow.
Oh, my gosh.
Yeah, the
Okay.
Portland energy tax was the cash flow, the
Okay.
disbursement flow. The 24 and 32 million that's in the letter,
Uh-huh.
he's firm on that.
Okay.
So I said, if you're so firm, please give me the calculations and the resources that support that.
Okay, I'd always thought that had come from the energy tax, the idea for that.
No, they only use the energy tax as a modeling for the ramp up,
Okay.
not for the total.
Okay, maybe I'll just have it offline for you because I'm not
Sure.
quite getting it. My next question, I'm confused about this idea of a 24 million loan. I had understood from my conversations with Gary, from talking with Jill, from talking with Christine Lewis, that if we had asked for an advance, Metro would be open to entertaining that. Is that not true?
The minute I heard that, I put out my feelers and I contacted Lynn Peterson and I contacted Christine Lewis, arranged a lunch. And I follow back up and I basically asked, and the answer was, that putting confidence into Councilor Lewis's comments or thoughts on this, and we went back and forth and we shared that with the group on Thursday. And what we learned is that once we solve or resolve this oversight, this 8.2 million with this whatever this claim is, once that is done and the IGA, any interpretation of the IGA ties into the interpretation of the LIP, all of it, then we can ask for a 5 and confirm that.
That's what
Confirm that, Martha.
I would say.
5, not 24, 5.
Well, I had never heard 24. I'd always just heard of just advanced gap funding
Right.
as to what was needed. So that was news to me. I don't know where this is the first that I've heard of that.
Well, I think a part of the problem is, I have to be honest, I got called from some advocates saying to me, if you ask Metro, they'll give you the money. And that was a red flag to me, quite frankly. I thought that was odd. I've never had anything like that happen before.
So I asked, basically I asked, and that's the answer I got back, was, if we can solve all this, you can put a
Okay.
request in, the BCC in, for 5 more.
And all this is clarifying what our local contribution to homeless services is, so that that's clear, that we're not displacing our dollars. That's one item. I'm just trying to remember from the Metro Oversight Committee that I listened to. That's one question. And then the next question is how we are rolling out the local implementation plan. Those are like the two things that are outstanding. Is there anything else I'm missing?
Basically the rollout of that, getting it past the Oversight Committee, and that is dependent actually on the interpretation of the IGA, which is being discussed today or negotiated today and tomorrow. And once that's clear, then it'll be clearer as to how the Oversight Committee and all of us interpret the LIP. And Jill knows this really well.
Yeah, she does.
So she's the resource on this. I trust Jill on this.
And then my last question is that I know that some businesses and individuals are paying into the portal to pay their taxes, and just red flag, I've heard of some concerns that, look, we're paying for this, we need to be really looking at how to build the capacity to deliver these services. So that concern is out there.
Yeah. Well, I would just say that I hope the dollars are paying in, accomplish the mission in general that we all want to see happen, right? The big mission, solving chronic homelessness, in 10 years. But 250 or 118,000 does not go very far.
Yeah.
And I'd like to
Martha,
add,
did you want-
I'd like to add to that too, because what I'm very worried about, is one of the reasons why I'm willing to put my head on the chopping block here, which is what I feel like I'm doing, is because I'm worried about the trend of hopefully the trend will increase. But right now, that lack of certainty with everything that's been thrown around, to me, that's a real issue. I mean, there's just been too much uncertainty with this for us to, we can move forward with what we can move forward with the dollars that come in. That's the issue, so.
And one other thing too, Chair, if I can, I just want to just validate or verify for anyone listening to go back, and that is that I think there might be a misunderstanding as far as what the role Commissioner Schrader and I play in this, and Commissioner Fisher plays in this. I am not no expert on supportive housing services. That's not what I do. I think my role that I'm volunteering, so to speak, or in my role, my capacity as a commissioner, is just simply the financing piece and helping put the structure together to get the cash flow to make this happen. And Jill and staff have the skill sets to know what they're doing and talking about. I don't profess to know that. I don't have any authority. Chair, you haven't granted me any special authority. The board hasn't granted me any special authority. Commissioner Schrader has been great to work with and understanding the nuances of all of this and working with our staff. So she brings a certain a skill, and I'm bringing a certain skill, and Commissioner Fisher's bringing her skill with as our representative on the oversight committee. And but none of us have any individual power. There might be some misunderstanding that perhaps you felt or someone felt. I think a misunderstanding that somehow this is being controlled by myself or Commissioner Schrader and I. It's not.
I have not,
Yeah.
not from me. I think you guys are doing yeoman's work. I've always said that. There was never a misunderstanding on my part at all. I think you're doing very good work. So, Paul, if that was intimated, it wasn't from me.
Yeah, and I just want to applaud all the staff, and I want to applaud Gary for, number one, putting back the task force together. I think, Elizabeth, Comfort, and Jill, and Rod, and everyone who's part of that housing task force, just bringing that group together to work with the regional partners, and their relationship with all of our regional partners has been really good, and hopefully, again, these negotiations with Metro and the counties on the IGA will be resolved here pretty soon.
And I'm hoping, Commissioner Fisher, you can help with the oversight committee so we can get those answers.
Yeah,
I think Jill's been working on it, if I'm not understanding.
Yeah, we got calls for some of the members of the Oversight Committee thinking that we had $18, $20, $24 million, that we just asked for it, we get it, and I had to explain to them, I go, that's not the information I got directly from the Metro Counselor.
That's interesting that they would think that.
Yeah.
Very interesting.
Oh, people just want to do the right thing, and they see this as such an emergency.
Mm-hmm.
And unfortunately, we're in the position where we kind of have to be.
Well, maybe this is an opportunity to explain how tax collections work. The sheriff always told us, they passed the sheriff's increase in their levy, an additional 12 cents. But we passed that in May of this year, 2021. But as the sheriff said, they will not realize any collections until the end of '22 on that particular, because it takes that long for taxes to come in. And maybe that's an understanding people don't have. They're paying up front, like Commissioner Fisher, you just said, you have people paying that, well, no, it's a couple-year lag time before there's any realization of the money you've been paying in. Commissioner Fisher, you have your card up again.
Yeah, thank you. So I think the question that will be out there, based on my involvement with developing the local implementation plan, is what the people that are currently unhoused, is the outreach and the navigation services for those folks is what we haven't rolled out. I had a briefing yesterday from Jill and Vahid, and the contracts, the request for proposals have gone out. They have providers that are going to be implementing programs for the individuals that were sheltered because of COVID, FEMA relief dollars that put people in motels, hotels, and also through what's called the Metro 300, which was a substantial number of seniors and people with disabilities that are currently housed right now, and this will help provide the navigation and case management to get them into more stable housing that's not temporary. But the piece that this board will have to answer, which I can assure you the Metro Oversight Committee is going to be looking at, is what are we doing with those very key elements of navigation, community engagement, and outreach for people that are currently unsheltered. And in Clackamas County, it's different. Like, you drive through Portland and you see tents everywhere. In Clackamas County, the people are mostly like around 213 in the woods. They're along the highway. They're down by the river. They're by our businesses on 205, but they're all out of sight. We don't see the people that are unsheltered. So that outreach piece of people building those relationships is a huge capacity building need that we have in this community. And that will be a question that they will ask. So I just lay that out there. And I know with Jill and Vahid, they have a plan for that next phase. They're going to be talking with you two, I guess, on Thursday. And that will be left to come
Yep. And like I said,
to work that piece out.
you know,
Things like timing, things are coalescing. Hopefully the IGA gets done soon.
If the IGA would make a huge difference if you could just get that out.
Yeah, that's huge. You know, I think that'll be a huge relief. And again, I think it's valuable just to get a sense of where we were and what we thought, and what we were guided to believe and think. Just listen to that audio tape of August 13th. April 13th. That'll just tell you where our heads were back then. And we're quite a different place today.
I know, I feel like where we were with COVID on, when was that? June something, and we were all excited because we got to get rid of our masks and we were walking around. I posted things on my Facebook about throwing it away, and now look at us. Anyway, the only constant is change, right? That's the only thing that we can rely on.
I know, we're doing a lot of that lately, and I think we're all striving to some consistency in we're doing in one topic. You know, it's constantly changing. We're trying to figure things out, and we will be successful in what we're doing. Martha, did you have another comment to make?
No, I'm done.
Chair Smith, before we leave this, can I leave one more comment? Just to plant the seed in your, as you look through this, because I know the Oversight Committee will be asking about those elements of our plan, to look at other available options if it were to be an advance for Metro or ARPA dollars. My understanding is that is allowable, or we have that guidance. And just to keep doing that, because I don't want to see us going sideways.
And I'm going to tell you right now, I'm laying down the gauntlet here. I am not the least bit interested in a large advance/loan, whatever you want to call it, with an interest rate that we'll be paying. So it's going to have to be real dollars. I'm not interested in any shell game in this, so I will put my reputation on that one. So don't get Commissioner Savas and Schrader get too far in front of your skis with another advance coming in by the end of the year. We're going to have to figure out something else.
Well, I'm hopeful that we might be able to use ARPA dollars. That's what I'm kind of hoping we can do. This just hasn't been any certainty from the federal government, at least from what I understand. I don't know, Gary, if you...
We're not getting any more certainty, so.
No, so we don't want to get just kind of take it, and then, we're getting different, so that's worrisome too. But I would be willing to use ARPA
What is the
dollars.
information on that? Because we have different understandings.
Well, we're still waiting. We had the briefing from Nancy earlier today, Commissioner Fisher.
Yeah, were you here when Nancy gave her briefing?
Yeah, but I understood, maybe we hear different things from where we were reported.
No, they're still, what, the end of
We're operating on
fall?
interim
I mean, they
guidance.
still haven't, we're still
And
waiting.
that Stephen issued, maybe we just need to ask, what is the
No, we did
guidance?
ask. We're not going to ask again. She gave her presentation this morning. It's going to be at the end of fall. We're not going to rehash what we rehashed this morning. And I'm really losing my patience with a lot of this right now, on a lot of topics, Commissioners. Commissioner Savas, you have the concluding remark on this topic.
Yeah, I just want to say that I am really, no matter where, if we if there's any advancing or loans or anything, or we're forced to pay back, we are going to be forced to pay back some of these monies already, the $5 million for sure, one way or another. But I just want to say that I'm anxiously awaiting, and I'll ping Mr. Stoll and Metro again for those calculations. I can't convey confidence to myself and you all in this capacity without some calculations. And let's just face it, I did get a correction that it was $125,000 per filer. So just think about how many restaurant owners that have shackled their doors, who are probably in the north of 125,000 that are probably not making 125,000. So I don't know what those impacts are, but I think between getting the calculations and the resources, I think we can get some new, fresh numbers from the state and try to get some kind of forecast from the State Employment Office, what the income levels may be, and then use that
Well,
on a
income
grander
levels are
scale.
one thing, but like you say, who's going to be left by the time we go through a series of shutdowns and masks and mandates and all that kind of stuff? And you make a good point about our businesses on that. There's a lot of unknowns out there. Okay, Gary, what's up next?
Next, Regional Congestion Pricing Study Update, Commissioner Savis, and there was a memo we sent to you yesterday.
Yeah, so in the packet, you saw a memo, and we sent a letter to Metro JPAC. And what's coming up on Thursday morning is the decision that Metro will make on whether to move the RCPS, a regional congestion pricing study, forward. And I think that staff at JPAC Metro did make some accommodations in there. It was discussed again last night at the R1 Act meeting, the Region 1 Transportation meeting on congestion pricing and so forth that they had last night. But I'm not sure we're quite there. Maybe there's some language, but as is currently crafted in the packet for Thursday morning, I'm inclined not to support it on Thursday. I just wanted to let you know, and if you had any thoughts on that. But we have not seen any significant response to our letter, but there might be some language afoot that might be changed to come Thursday morning. So in the packet, you'll see that memo. So any questions from anyone?
Well, let me make sure I understand this. There was a study, and there's an effort to accept this study, but not to necessarily accept the recommendations about it. Is that right?
That's what was a proposal that was put out there, but that's not what's in the packet today. What's in the packet
Well,
today?
I'm just trying to make sure I understand the overall framework.
Yeah, what's in the packet today is accepting the study with the findings and the recommendations. That's what's in the packet for Thursday.
To accept all of it. And so you will be voting no because you do not agree with the findings and recommendations.
I don't believe it's ready because they don't think we all asked for, not we all, but a lot of us asked for further study and impacts. It's in the letter that we sent in July and also in the memo. And they've come a little bit farther, but not quite enough. There's a proposal maybe to not accept the recommendations, or to strike the word recommendations. I thought, well, perhaps if they can get to the point of saying, we will accept the findings and not accept the recommendations and put that in the RTP, I might be able to get there personally, but I just wanted to let you know where I'm inclined to. I might have to think on my feet Thursday morning if there's some suggested changes. But I think the impacts are huge, but the study's not in detail enough to understand what those impacts are. You got to remember, on congestion pricing, the principle is it's to change people's behavior. So putting pricing on parking and making things more expensive is to change their behavior. If there's not a choice, like a lot of Clackamas County doesn't have transit, doesn't have any other means other than a car, they don't have a chance to change their behavior. They'll be forced to pay. And that's not equitable when you compare to other parts of the region like Portland that has all sorts of alternatives and a grid structure and a number of things. So this puts a severe disadvantage to those in Clackamas County, and someone has to, well, I just happen to be your voice on that. So that's where I sit today. If you all feel that you want me to vote yes on this, tell me now, and I will couch it that way. I'm your representative. I'm trying to bring it back to you so you know where I'm going to be Thursday morning.
I have not studied the study, so I'm not sure specifically about what the recommendations are that are of concern to you. I just know that, just what you said, we don't have a grid system. We have certain ways across the county, and Clackamas County could be very much disproportionately affected by congestion pricing unless all of those factors are taken into consideration. So I'm not sure if there are specific recommendations. I'm looking at the letters, but I don't see a link to the study.
Yeah, and just so you know, I mean, this is not a decision on whether or not to toll. So let me just put it to you this way. Metro made it very clear at the last meeting that they don't have the authority or intention to implement congestion pricing. But if it gets included in the regional transportation plan and there's no further work, then it could be that a city could say, you know what, I'm going to go ahead and do congestion pricing study, or congestion pricing, and just implement it. Because once it's in the RTP, it's basically like a, so to speak, a permission, so to speak. You know, if it's in the RTP, I can do it. And if they do that, then what are the impacts to everyone else? I laid out a scenario yesterday, said, well, just imagine. So let's just say Milwaukee puts in a congestion pricing, and Tigard puts in congestion pricing, and Portland puts in congestion pricing. Well, that's one machination with all kinds of impacts. And or what happens if Hillsborough does it, and Happy Valley does it, and Portland does it? What are those impacts? So there's 25 cities in the urban area that are affected by this, and 3 counties. So all to say that those impacts have to be studied together, whoever's choosing to implement it. And
I don't think that cities are going to do their own congestion pricing. It's too much of a heavy lift. It's too complicated, the collection of taxes, the monitoring, the enforcement, and they're going to find that they can't even install traffic lights to get speeding tickets. They have trouble engineering that particular fee. So I don't think that particular item, Paul, is an issue. Now, if there's something else in this that we are opposed to, I'd entertain that.
well, the other one was we haven't identified the funding, like where do the revenues go? And not only is congestion pricing an element of this, but parking, vehicle miles traveled, which is the future replacement for gas tax, is incorporated in that. And there's one other one that I'm leaving out here that's embedded in that as well. But believe it or not, Chair Smith, there is at least one city, perhaps 2, that are considering this as a method.
Well, they can consider it. I think when they start doing a deep dive, they're going to find out it's going to be a considerable investment with the payback will be not what they think it's going to be. But that's just my opinion. Now, Paul, what is the implication if we just go in and vote no?
I don't necessarily think there's if we vote no and the rest of the region or majority votes yes, there's no implication.
Okay, then do that.
Okay.
I don't have a problem with that at all.
Right.
And because and then you can say your reasons why. And I think, as long as you justify, you have reasons, these are the concerns of Clackamas County, Commissioner Fisher?
Yeah, so I was looking through the materials provided today in our issues, and I want to make sure that these are the recommendations that you're concerned about. It's on page 6 of our packet.
I'm trying to open it back up. For whatever reason, my iPad here went crazy on me. I lost everything. I had everything opened up.
On the congestion pricing one?
It just says that congestion pricing can be used to improve mobility and reduce, it looks like a value statement, basically, but define clear goals and outcomes from the beginning of a pricing program. The program priorities such as mobility, revenues, or equity should inform the program design. Recognize that benefits and impacts of pricing programs will vary across geographies. These variations should inform decisions about where a program should target investments and affordability strategies. I mean, are these the because I think these recommendations look like they address our concerns about the unique geography
Well,
of Clackamas County. So are these the recommendations, Paul, or is there something else that you're concerned about?
No, that's just a snapshot, Sonia. I don't know why I'm having a problem here right now,
Yeah, I
but I am.
So if you go to issues
Yeah,
and
under
then link
issues.
on the congestion pricing, and then there's Paul's letter that, the memo for today, and then there's the previous letter that him and Chair Smith signed, and then there is a handout.
There we go.
Can't find it either. It's under our issues.
Yep, I'm
Today.
finally able to open it.
Yeah, I know, that's why I'm.
Yeah, so you see really, so anyhow, we sent that letter, and so what you see in bold there, however, the study itself does not provide the necessary in-depth analysis to understand local implications or consider the importance of a regionally cohesive, seamless approach across road ownership and local jurisdictional boundaries. Additionally, to date, the RCPS has not been informed by a parallel policy conversation to build consensus around regional issues such as establishing shared goals and outcomes, and a big key thing here in determining the revenue sharing. So that's at the local. So this is a local tolling congestion pricing. This is not the interstates. ODOT is doing the interstate tolling.
Right.
It's authorized by the legislature. The decision maker for that is the Oregon Transportation Commission. So that's a separate thing. So this is something within the boundaries of Metro, in which half the county is population-wise. And therefore, that revenue sharing, because they included VMT, which is going to replace the gas tax. So just want to let you know that all of our dollars at paved roads are based on a 50-30-20 split. So every dollar of gas tax collected, 50% goes to the state, 30% to the county, 20% to the cities. They've included the VMT, which replaces that, and there's no lockdown or surety that the revenue sharing for that will be equitable and replace that at the same proportions. And if there's extra revenue sharing, how does that bring back investment into Clackamas County for things like transit and sidewalks and grid structure and all those things, so people in Clackamas County can have alternatives? And that seems to be a conversation that no one seems to want to talk about, even though we keep on asking about it. And that's where the study also falls down. We wanted that.
Well, it seems like-
Hillsborough has been very open and active, and they've been saying they want a mesoscopic study to understand those impacts throughout the region. And I agree with them. I'm not sure we're going to get there, but we're in agreement with that.
If I'm looking at this correctly, the recommendations create a framework to look at future congestion pricing. I think the piece that I'm very concerned about is Clackamas County is unique from the region. And if we, by chance, if we collect a lot from our residents, and they're paying disproportionately, but if we don't collect something, then we're going to be, disadvantaged because we won't have the money that we need to, do the improvements that we need. So either way, it's really messed up for us. So really having a strong voice to look at this regionally will be very, very important.
But another way of looking at it is if you are a Clackamas County resident, you're driving in Portland, and Portland has the tax, does Clackamas County get that revenue because they didn't have an alternative? Or does Portland get the revenue?
Yeah. So those types of things, it seems like what they're saying in their recommendations is to look at that, look at the geographic differences.
And that's
I mean,
what
it looks like this
that's why
framework is
we're
pretty
asking
good.
for a deeper study, because they didn't answer those questions.
But, yeah, and I didn't read the study, I'm just looking at these recommendations that were provided. I think the recommendations look pretty good. So I don't know if you want to make your statement as to what you're concerned about, because we have been very clear as a commission when we testified, or Chair Smith testified, on the tolling issue. We laid out those values. We have a whole statement on our values, which is great to adhere to, and then I think to state that, Paul, it will give you a stronger voice about what we're really concerned about. But this framework, the recommendations, they look pretty good.
Yeah, and when this came up, I found out that the letter had not been included in the packet. And so I think what I'm inclined to do is to, typically, you walk in the room and you make sure everyone has one in front of them.
Okay, let's make a decision on this. We're discussing this. I'm growing weary of going back and forth on this. So Paul, you're asking if you should support this in JPAC or not. Is that what you're asking
I
us?
just tell you what I'm inclined to do. If you want to support that, great. If you're
I think
an
that's
adamant no,
fine.
then just tell me.
I think that's fine.
Okay.
All this tolling, everything is just getting out of whack. We're just going to have to start, I think, taking some hard positions on a lot of issues, and we might as well start with this one. Okay, Gary, what's up next?
All right, next, potential resolutions regarding the pandemic. Chair Smith, if you'd like to kick it off, or I can if you'd like.
In front of you, Commissioners, there are some resolutions regarding the pandemic that I think addresses a lot of issues that need to be addressed. I have I've been contacted a lot by a lot of different people. Why aren't you doing this? Why aren't you doing what other counties have done? At this point, this commission has not adopted any resolution regarding the pandemic or any mandates. I personally like the Jefferson County resolution. I think we can get to that. On that, I'm going to entertain a motion. I'm hoping I get a second and we can discuss it.
So, Chair, I read it, and I got some thoughts, if I may.
Certainly.
So, I am concerned that, and I heard, and you shared, and Martha shared what happened at AOC yesterday, and but I'm concerned that the way it's crafted, really doesn't have a solution in there, for example. It's really basically asking the governor to roll back, the mandate. And
right.
So right now we have healthcare workers, frontline workers that are already, as they're cited, but for the very reason of just the COVID outbreak, they're really stretched to the limit already. And a lot of these people that I'm referring to, let's just say, they're vaccinated people, let's just say. And I have a family member, that's one of them. I have two family members, but one in particular who's working in a hospital is about on her edge of actually quitting because they don't have the confidence that they have the support, and they don't feel as though that the people are not taking the steps to care for themselves and get the vaccination. So on one hand, you have folks that are maybe frontline workers that don't want to get the vaccination for whatever those reasons are. We have folks that already got it but they're already overwhelmed. The point is, those frontline workers are overwhelmed. So the governor, I would imagine, in every state is going to be faced with, well, what if these people walk out for whatever reason, walk out because of the mandate, or they walk out because there's no support, because there is no mandate? There's already going to be impacts. So if you're the governor of one of these states, what do you do? And I'm afraid that step may be a lockdown.
Well,
and I don't want this. I don't want to prime the pump for a potential lockdown, shut down our businesses all over again because our hospitals are overwhelmed.
our hospitals are already overwhelmed. I keep telling you people that. And I'm growing frustrated that I don't feel like this point of view is being listened to. And I feel like this board has already dug in its feet, and we're not listening to a great amount of our county employees who are very concerned about the mandatory vaccination. I've been in contact with our hospital groups. They're probably at wit ends because they have they only need another 10%, Paul, of their nursing staff to quit because they don't want to get the vaccine. And they're going to be in dire straits. The numbers are coming down right now. I think the numbers, it was predicted a month ago, before the new mandates came in, that the numbers would come down. So I don't know if the new vaccination rules had been in effect long enough to make today's numbers come down. I don't think so. And if the leadership in the state of Oregon wants to take credit for that, I don't think they will, because they know it's misguided. We have our county sheriff's department, and I've been getting reports of the numbers of people of our patrol and our jail staff. It's new numbers that came in recently that they say are going to walk off. Now, our position is, these county jobs are so good, and we pay so good, and our benefits are so good that they're not going to walk away from Clackamas County jobs. Well, I would hope that would be the case, but we are offering things like exemptions. Any county employee in any position, if they're mandated to take a vax, can file a religious exemption or a medical exemption. And I hope that the county supplies that information to do that. And I think there's a whole population out there that we have systematically ignored through this, and that is choice. We have, no, I believe that the actions that we have failed to take, I mean, Paul, you just said it here. You think we should get vaxxed. Martha has said it. Sonia has said it. We should get vaxxed. We should get vaxxed. We should get vaxxed. Yeah, well, we have said that, and the actions that we have taken as a health authority have provided vaccination to those who want it. I also think it's a time that we say to our state government is enough. It's a vaccine mandate. I do not think it is the right thing to do. I think you're going to have more and more counties come out against the mandate for the vaccine, and I'm offering up today. Paul, if this wording isn't good enough, do you have replacement wording?
Well, I was thinking about maybe actually putting something on the table that would be, like, what do we do? Do we ask the governor to consider calling the National Guard in to replace healthcare workers? I mean, what do we do? I mean, I'm looking for something that's solution-based that gets towards that. I don't want to ask her to lock everything down. I am very sympathetic to people that have their religious reasons for not getting the vaccination, or the fear of the vaccination, or whatever it may be, or all of that. I understand that. I understand, and I sympathize with the folks that are on the front lines that are feeling, my gosh, these people, aren't, we're overwhelmed. We don't have the support. So I sympathize. I understand that. But as leaders, as the county health board, I think we ought to be somewhat in the position of offering or proffering some solution to that. Maybe the numbers it's been announced on the news, you just said it, I'm hopeful. I've seen the numbers starting to climb down, and maybe if the numbers go down, it's not an emergency, it's so much of an emergency, and maybe it'll level out here. That deadline is what? Is it October when? 18th? 18th. So we've got over a month, it's just a little bit over a month. So, but if we send something, I want to make sure that we've got, again.
What is your recommendation?
Maybe we can craft a resolution that includes some actions like tapping the National Guard, and something that's more solution-based. I don't want to see our employees lose
I don't know that
or
we
leave.
can, hospitals are private entities. I seriously don't know if we can compel the National Guard to go to a hospital, and we would have to pay for that service for the National Guard. They are not free.
They are at the hospitals right now.
Well, Kate Brown has sent them to some hospitals to do administrative work, but they are not providing medical work. But that is an issue. Lack of people in administration is an issue. I mean, you talk to people, you call up, I can't get through to anybody at the hospital. I've heard that a lot, and it's because stuff's happening. I don't know what the solution to this is either. I just know that I think we need to speak for some people, a lot of people in the county regarding this. If this board wants to wait, we can wait and see what happens. Martha, you have your card up.
No, that's okay, but you had yours up.
Sonia, you have your card up.
Yeah. Chair Smith, I think you made one word that you said, which I think is so important. is choice. And if we're going to be looking at this issue in a lens that will actually somehow get us through this pandemic, if we can problem solve, how do we maintain the integrity of choice and craft good public policy? So Martha has shared, I think she shared her envelope of all the COVID tests that she went through to get to Europe. I went through a pretty extensive, oh my gosh, it was not fun trying to get the vaccination card, uploading it onto this app for Hawaii, going through all of this work. But you know what? It was my choice to go visit my son in Oahu. It was Commissioner Schrader's choice. We're willing to do a lot when we have a choice. So I think that's really critical. If we were to, and I don't know the science about this, I don't know how quickly a test could come back, but I know that there are some venues that are doing testing for people to go see a performance indoors, doing those kinds of things. Could we look at that science and make a recommendation for either rapid, on-site testing for some of these? I mean, what are the other options that we can have choice be part of it? And I
Well,
think we would need our health folks to weigh in on
We're running out
this.
of time because if, for the October 18 deadline, people have to be vaxxed within 1 week. They have to have both doses by mid-October. And if you know, it takes, from the first dose, it's 3 weeks to the second dose, correct? And so we really are running out of time. So a lot of the people in our healthcare facilities and some of our county employees, it was identified 500 to 600 possible potential county employees would have to be vaxxed basically by next week.
They'd have to get
And if they're not vaxxed by next week, they cannot enter into the window of being in compliance by the 18th, at which time I suppose they can file their exemptions, and at Clackamas County, we will not fire anybody. Gary has said that time and time again. But will they still be able to work in the areas where we need them? We don't know that, I suppose. Gary, what's your opinion on that?
The employee will be reassigned to the best of our ability, yet the other issue is if they lose their state licensure, which is also part of the governor's requirements, if they're a healthcare worker, for example, then they can no longer do the job they were hired to do. So they would have to be reassigned to another position, and that's up to the employee if they would accept that reassignment or not.
And then we'd still be lacking, for instance, in the medical services at the jail or some of our health clinics. I don't know how many of county health workers have been vaccinated. I don't know that number. But I am hearing from the Police Officers Association, and they are quite adamant. And I shared that earlier with you folks.
Yeah.
So it's really, I mean, I'm willing to do this. Mark?
I think the number one concern in the county now amongst the people I talk to seems to be the resentment of being threatened to be fired for not getting vaccinated, and therefore losing their ability to support their family and essentially being shut out of society for not being vaccinated. Somehow that message in a resolution needs to get out to the governor. That's the number one concern of people now. And we're getting down to the point now where anybody who's not vaccinated is probably not going to get vaccinated. And to force the issue causes a friction that we don't want to deal with. People need the right to choose and keep their job at the same time.
Commissioner Schrader.
So I have a question that this is only referring largely to public employees and public bodies, is that correct?
No.
No, but It's working families across the whole, no matter if they're in a restaurant and they're whatever.
So, okay, so there's two issues. So one, the governor of Oregon has stated, made by executive order, anyone that works in health care or schools in the
Okay,
state of
that's right.
Oregon
Okay, health
must
care
be
schools.
vaccinated or file a religious or a medical exemption. No testing options. That's what she decided. Not every employee, just health care or schools. President Biden said last week, he's going to, by executive order, say any employer with over 100 employees must be vaccinated or have weekly testing. We don't have final guidance on that rule yet. We don't know if it applies to governments or just businesses, so that's on hold until we get more clarity. So those are the two different issues going on right now.
Well, here's my struggle with this, and I did talk to you about this, Chair, and I consider you a friend. Well, I'm struggling with this, I gotta be honest with you. And not the least of which is that, for me, the dilemma is personal liberty versus community responsibility. Both are important. And the reason I have always told people to get vaccinated is it's a choice. Sure, it's a personal choice, but I also think it's largely a community responsibility because it's a pandemic with a dangerous virus that has shown to be lethal. I know that some data is showing pediatric cases are rising around the country, so that worries me. And the other thing I will tell you is that both, I think I've told you this before, both my parents were nurses. They were first responders. My father did triage at the Hindenburg disaster, not that anybody even knows what the Hindenburg disaster is anymore, and I will tell you, they would have been the first in line to get vaccinated. And I've also said before that for me, I not only had to go to the doctor to get shots, my parents would give them to us because they were registered nurses. So I'm going to have difficulty getting there as much as I would, I'll be honest, really like to accommodate you because I understand your viewpoint. But I don't think a resolution like this has the weight of anything, and I think I would prefer to see something more like testing rather than, actual, I'd rather see the solution to it if people don't. The reason I like the testing idea is largely because it's also preventative. Let's say somebody tests positive and we're moving ahead with, what is the clonal thing that you've talked about before? I can't remember.
Monoclonal antibody
Okay,
treatment, which Clackamas County, I think, was one of the first to even do that.
But see, that would be more, to me, that would be more of a solution if we could.
Well, it is a solution.
Yeah, it is, and do testing, and then if we have somebody positive, we can get them the immediate care. And, maybe we should do a resolution saying we're going to strive to, from our perspective, because I think someone needs to be talking directly to the governor, and we need to be getting a policy that allows us to do that.
Well, I have offered this up to the governor, I'm going to tell you, and I was
what's been her
slammed
response?
down in a statewide conference call with the chairs. And I pointed that out to my tri-chairs the following Monday, and they observed that. And as of this Monday, the tri-chairs from the other counties want to do exactly what we have done in Clackamas County. And it was at my insistence, Gary, I came into your office. I had spent the weekend researching this.
Mm-hmm.
It's run out in other states. And just because Oregon is doing this, I would recommend that you folks look at what the other states are doing. And they are not this severe. Oregon is the most severe of 50 states. And what I'm trying to do with this resolution, going forward on any resolution, is I'm trying to strike the middle ground before it disappears. Because I can tell you right now, we go into October, and we're going to be struggling to find a middle ground on anything. That is my opinion.
Okay.
And I'm offering up the leadership to this board to go forward with this. I would like your support on it. I can go back, Stephen and I can sit down, go through this resolution, and I can bring it back.
I will tell you today as written, I couldn't get.
I want every
prevention.
commissioner
Yep.
to take a look at this Jefferson resolution and the Baker resolution. And I want you to print it out. We're going to do old school. I'm not going to sit here and be snowballed by my fellow commissioners on this. I want every single one of you to get a copy of the Baker and the Jefferson County resolutions. I want you to write on the whereas, if you like it or not, yes or no, and then I want you to write your own comments, because I will bring back a resolution. I will make a motion, and everybody is watching.
Oh, I know, and I will tell you that I understand everybody's watching, but I feel like this is the way I kind of feel about the heat I'm getting from the here, the whole Here Together social services you supported. I understand.
And I'm getting the
basis
same
behind
heat
it.
that
And
you're
you are-
getting.
You are too, and so, and I'll be honest with you, if I have to put my neck on the chopping block,
Okay, fine.
I'll just have.
I have made a
I'll just
request
have
to my
do that.
commissioners.
Right,
I
yeah,
want you to look
I
at the
got it.
Jefferson resolution, I want you to look at the Baker resolution, and I want you, if you can get it back on my desk by the end of the day tomorrow. This is not hard work. What's hard work is taking a stand and making this. I'm trying to strike a middle healthy ground while it still exists, because that is fastly disappearing. Commissioner Fisher.
I really appreciated what Paul said about looking at a way to get through this and looking towards the future and looking forward thinking. I don't think us going with a statement about telling the governor to remove mandates is the solution. I think us coming up with what we would recommend, and
No, that's, yeah.
And I need more help in that. I'm not a scientist. I don't know how quickly the testing can turn around, how accurate the PCR tests, not the PCR, but the rapid testing is. There are things I simply don't know. But I can tell you one thing, I do not want us to go into another lockdown. And when I was in Honolulu and they were facing another lockdown, they made a shift to vaccine verification for the different things like restaurants, gyms, concerts. And I would be very much in support of that over us going into another lockdown, because people can have a choice in that sense. They aren't able to fly to Hawaii or fly to Europe or go here or go there or do this or do that. Go to Timbers game, which I'm doing next week. I mean, those are things, if you're vaccinated, you can do it. If you're not vaccinated, you can't. I think that would be a more effective way through this pandemic than a lockdown. It's going to devastate us. I do not support another lockdown. But if we could come together with what is it that we would recommend instead of, no, Governor, don't do this, I would be in support of that.
So write it down for me.
Okay,
Just don't sit here and tell me, put it down in writing.
all right.
And I'm serious.
Well, and I'm serious too. We really want to help you. I understand the pressure we're all under with this.
Well, I've been chair of this board long enough to know that my commissioners are real fine about telling people what to do and not rolling up your sleeves and writing it yourself. So I want to record myself. With that in mind, this meeting's adjourned.
Okay. Sorry you're disappointed.